Yes.
All right. Hello. I'm going to tell you a little anecdote here. Sue Rodriguez, a mother in her early 30s, died slowly of Lou Gehrig's disease. She lived for several years with the knowledge that her muscles would, one by one, waste away until a day came when, fully conscious, she would choke to death. She lived in fear every day of her remaining life. Now, she begged the court to reassure her that a doctor would be allowed to assist her in ending her life and choosing her moment of death. But they refused, and she lived on in terror. But she was eventually helped by a doctor who covertly broke the law to help her die in peace. Now, what is illegal is for a person to end their own life on their own terms, especially if they have a terminal illness that they will die from within 6 months. Now, I would like to propose that physician-assisted euthanasia should be made legal, so patients do not live in fear and in constant pain, simply because the law does not allow them to end their life. The illegality of physician-assisted euthanasia violates our personal freedom and autonomy. And the Supreme Court has decided that the right to good death is a basic human freedom. However, without this basic freedom, some people resort to extreme measures and may commit suicide in a messy, horrifying, and traumatic manner. Now, also against legalizing physician-assisted euthanasia, are cultural, religious, and political stigmas, where a religious stigma, for example, is that Christians hold that the decision of when and where the time of our death should occur is one that only God has the right to decide. While a socio-political stigma is one held by physicians, where Robert Orr, an MD and the president of the People Against Euthanasia, we believe that the medical tradition that has been in place since the time of Hippocrates for over 2,500 years is still valid, meaning that he holds that doctors should not be allowed to aid people in ending their own life. So I propose that to help and alleviate the suffering of terminally ill patients, we must allow physician-assisted euthanasia. Now, and a terminal illness would be defined as an infection or disease that is considered ultimately fatal or incurable. Usually, a patient is considered to have terminal illness if they are likely to die despite diagnosis and treatment. Although it is possible for some people with terminal illness to live for years before succumbing to their condition. Our proposal would be similar to the Oregon model. In Oregon, it is legal for physicians to assist their patients in ending their own life. In Oregon, physician-assisted suicide is legal. That is, the physician supplies information or the means of committing suicide. And that would be through voluntary euthanasia, meaning that the physician will provide either an injection or a dose of lethal drugs that the patient themselves will administer to themselves. And what would not be legal would be passive euthanasia, where the physician simply withholds treatment such as drugs or food and water, or the removal of life support from the patient. Our policy will have several restrictions on it, meaning there must be a written request by the patient. It must be, the patient must have a terminal illness, the patient must be 18 or older, and the physician must consult with other physicians So it's not just decided by one physician. Also, the physician must offer alternatives such as palliative care and pain management, such as morphine drip. And the patient in question must be a specialist specializing in their terminal disease. So a cancer patient must be a cancer specialist to get their request confirmed and approved. So approving physician-assisted euthanasia will lessen the pain and suffering of terminally ill patients in the country.
Who's keeping time? Please stop. Not that way. I meant with the pounding of the foot or the leg or whatever it is that the noise is.
Oh, sorry.
I'm sorry, that's distracting. Jonathan, I didn't mean... No, what you're doing, I was making a joke. Who's keeping time with their foot or whatever it is?
Sorry.
It was a little distracting.